Welcome, everyone. I'm Matt with Vitality Fitness. We help women and men over 50 to get back their health and fitness, to get out there and enjoy the adventures of life with ease and vitality. Sometimes we hear from people who are worried about getting started with exercise or think they can't exercise because of knee pain. We have helped many of our members conquer those fears and move past their aches and truly crave activity. We are excited to welcome Dr. Iannaro from Rehab to Perform. Rehab to Perform is a physical therapy company focusing on helping athletes, active adults, and those looking to be more active reach their highest level of performance. They are located in Frederick, Mount Airy, Germantown, and Bethesda, and are in network with most major insurance providers. Without further ado, I'll turn it over to Dr. Iannaro, Doctor of Physical Therapy and Site Director for Rehab to Perform Bethesda.
All right, guys, thanks so much for joining today. I'm really excited to talk about this because this is a conversation I have on a daily basis with patients. You know, when is this point where I need to be worried about my knee? When is this point that I can, how do I exercise around this pain? And how do I know when I'm doing the right things and I'm not doing the right things for, the long-term health of my knee? So what I'd like to do, I have a little presentation prepared to go through a little bit of the background of how the knee joint works and some common misconceptions and some strategies we can utilize to help plan our exercise to be most conducive to long-term health for our knees. So I'm going to go ahead and share this PowerPoint. Okay. All right. Does everybody see that all right? Mm-hmm. Okay, wonderful. So like Matt said, my name is Dr. Iannaro, and I'm a physical therapist with Rehab to Perform. I additionally, prior to physical therapy school, was working in similar setting with individuals such as yourself, working through long-term health, wellness, strength conditioning. So a passion of mine is bridging this gap for people. I think of physical therapy and rehabilitation like a gateway drug to fitness. So anyone who's coming in, I try to think, what's the long-term pathway for this person to become healthier, happier, and have a long-term exercise foundation for themselves. So I'm really happy to hear that you guys have found that through Vitality for yourselves. And I'm happy to talk about different strategies that we can utilize to help that make that most fruitful for you. So let's see. Okay, objectives for today. I want to go a little bit of the background of the anatomy of the knee, the form and the function, about what our knee does for us, and maybe some anatomy terms that you've heard that might sound a little bit scary, kind of demystify them a little bit and talk about what those things really are and what they really do. Second, I want to talk about common myths and misconceptions about the knee. There's a lot of questions and a lot of things out there that aren't entirely true and kind of lead to some beliefs that maybe not be helpful, maybe holding people back as far as pushing more into their exercise as they'd like to. And then number three, I want to talk about strategies we can utilize to make exercise the highest reward with the lowest risks for ourselves. So first and foremost, I want to go through a little bit of anatomy of the knee. So our knee joint is really amazing. It's comprised of the bone above is the femur, which comes up and attaches to the pelvis. And then the bone below is the tibia, okay, which is our shin bone and goes down to our ankle. So one big thing to think about is that our knee sits in between our hip and our ankle and is going to work together with those areas. So the knee is never working independently. The knee does a couple different motions for us. As we know, it flexes and bends, but what a lot of people don't understand is the knee actually rotates when it does those things, and it needs to rotate to be able to have optimal health. So the muscles on the front and back of the thigh are really what help support and move our knee. So on the front, we have our quadricep muscles, because there's 4 of them. On the back, we have our hamstring muscles. And on the inside of the thigh, we have our adductor muscles. So together, these muscles all come across the joint to help to create stability and help to create movement across that joint. So some things we often hear about are the meniscus. And we hear about, the ligaments, the ACL, the MCL, the PCL. These ligaments and this meniscus all work together to form a capsule to seal the joint. Okay, so the meniscus works to create a stable and slippery surface for the bones to slide and glide on top of each other. So it's really frictionless. What actually happens is that it's full of fluid, and the meniscus with the fluid helps to create a space where the joints kind of roll and slide on top of each other without actually touching. So it's a completely frictionless environment that's really amazing, that helps us move really efficiently through our motion and help the knee have a lot of longevity. And we'll talk about that, what that means when we talk about degeneration, or talk about, you know, losing space between the knee with arthritic changes, and how that can affect our choices with exercise. So that meniscus is part of our process for stabilizing the knee. So we look at this jar here with this plastic rim. What that meniscus does, if you look, it's kind of like that plastic rim that sits on top of this container, because one of the main ways our joints stabilize is through negative atmospheric pressure. So our joints are closed pressurized systems that actually help to create suspension. So that meniscus helps to seal that off so that the pressure inside our knee can stay separate from that of the environment to actually help us stay stable. So that's one of the important roles of the meniscus in the joint capsule. Additionally, the muscles on the outside help to create compression around the knee to help keep some of that pressure inside as well. So that's why muscles are really effective. So we have a couple different strategies for creating pressure and stability inside the knee. So they all kind of work together for us. And maybe as one of our strategies stops working as well, we have to rely on that plan B and plan C strategy a little bit more. And that's kind of what we'll talk about in terms of how rehab works and how training and how strength training can be conducive for long-term knee health. So as I mentioned, like this knee brace, what it helps do is create compression. Maybe some of us worn these and felt, you know, that seemed to help. Well, the forever knee brace we have is the muscles that is, you know, even more effective. So like I said, those muscles, if we can keep them, you know, strong and toned, they can help to create compression across the knee to keep that stability and keep that pressurized system intact, to keep us from having too much friction or too much compression in the knee as we go through our life and our training. So I want to go through, after that brief overview of the anatomy and function, I want to go through some of the myths and misconceptions that we come across in terms of the knee. And I get these questions every day. So I want to address some of the more common ones that I see that I think may be a barrier to some people, you know, getting over a hurdle to doing the things they want to do. So the first myth that I hear a lot is bad knees run in my family. Okay, that, oh, my parents had bad knees, my grandparents had bad knees, so I'm kind of predestined to have bad knees when I'm older. And really what we find is that belief system, the expectation, can be limiting, because what it might do is it might actually predispose you to do less because you're scared about hurting yourself, which might actually take away from some of the positive aspects of exercise and as far as avoiding knee issues in the future. So what we find is that with genetics, it's really confusing as far as how much this does affect things such as osteoarthritis or degenerative knee conditions. There's some evidence saying that maybe it has an effect, some saying it doesn't, but the big thing we can look at is that genetics loads the gun, the environment and our actions pulls the trigger. So what that means is that we have an ability over the course of our life and over the course of our time right now to affect how our genes are going to express and affect the trajectory of how our knee is going to age and what kind of health and performance we're going to have with that. So this picture down here is kind of cool. It has to do with cancer actually, but the red encoded genes are all positive for genes that are linked to cancer. And after just a lifestyle intervention of exercise and diet, you see those red lights turn to green lights where those things are no longer encoded for that. So genes are not something that are stagnant and are fixed. We have a lot of something called epigenetic regulation, where we can actually change and manipulate what lights go on and what lights go off as far as how our genes are coding. So same thing goes with our knees. So if there is any conditions where we look at our family and see that, I think it's really comforting to know that we have control and we have some control over this and can take action to help prevent or slow down an aging process with the knee. The next thing is that running and working out is bad for my knees. I think a lot of the times the analogy that people think about is like a car. So they think, oh, when my car gets so many miles on it, my tires wear out, my suspension goes, my engine starts going wrong. And we think about that with our bodies. And that's really not the case. Our body is amazing, the fact that it can regenerate, and that when stress is put on it, our body adapts and gets stronger to that stress. So cars don't do that. I mean, we'd have really amazing cars if they would just self-regenerate and you know, you wouldn't have to get an oil change, go take care of itself. The tires would just kind of regrow and repair. But that's really what our body does. So if we think about just a simple aspect of muscle, and we know if I work a muscle and I work out, that next day I'm sore, what I'm doing is I'm creating a little bit of like micro trauma in the muscle that tells our body that, oh, this demand is something that we're going to have to face again. So the body goes in and brings the construction crew in and builds it back up so it's stronger, so that next time you face that challenge, you're more prepared for it. So any form of exercise does the same thing for us. If we're going out and running, if we're going out and working out, we're going to create a little bit of damage in the body that the construction crew is going to come in and build us up to make us stronger and better. However, what can happen, and when we do feel those negative aspects of activity or negative aspects of exercise, it's when the dosage might be too high. So just like any medication, you know, we can take too much. Just like any nutrient, we can have too much. So with exercise and with anything else, the poison is in the dose. So if we're finding that running is being a problem for our knees, it may not be the fact that the activity is wrong in and of itself. It might be the amount you're doing. It might be the strategy you're using with those activities. So finding a different strategy or finding a way around some of the issues rather than just throwing away the activity in and of itself is probably a more fruitful thing for you. I just see a lot of beliefs of running is bad, or, you know, walking or squatting or lifting weights is going to just kind of grind my knees. And that's really not how things work. It's more often than not, if done strategically and done with guidance and done with a plan, it can be the best thing for you. So the third myth is that arthritis is always painful and likely the cause of my pain, and there's nothing I can do about it. Okay, so a lot of times I hear this, and there's just a lot of pessimism, a lot of lost hope as far as, you know, when people get this diagnosis that, oh, I have arthritis. So if we really break down what arthritis is, it is age-related changes in a joint. Okay, we're going to see these age-related changes in every aspect of our body. So when we think about, say we get imaging done and we say, oh, you have degenerative discs, or you have lost space in your knee and have arthritis, it's no different than someone looking at it and say, oh, you have some wrinkles on your face, right? Those are normal expected changes we have in the body. And yes, it may change some of the way of the function we have. It may change some of our range of motion. It may limit us in certain ways, but all it means is that we need to be a little bit wiser and find different strategies around it. So yes, there is a certain point where arthritic changes become problematic enough where something like a total knee replacement or activity modification is going to be the best choice. But oftentimes I see people kind of throwing in the towel way before that's a problem. So I think the first thing is if we're having issues, it's not to say, oh, this is just the arthritis, this is my problem, you know, I'm never going to be able to do anything, I just need to stop and do this. It's saying, okay, maybe I've had some changes in my knee anatomy and maybe some changes that are affecting the way I can do things. So rather than focusing on the what I can't do, it's finding the what I can do. So we'll talk about this a little more in the strategy piece of things. But with arthritic changes, as they do progress, there's going to be certain items that are probably going to feel better and some that aren't going to feel as well. So again, we want to focus on those points of action rather than the points of inaction or what we can't do. Okay, what I want to talk about here is just, like I said before, when we start thinking about exercise, we don't want to think about the knees in isolation. We want to think about how the knees work together with the ankles and work together with the hip. So addressing range of motion and strength across the ankle and the calves and addressing range of motion and strength across the hips can be really conducive to taking pressure off the knee. What we'll find too is I talked about how the knee rotates. So what we can see with certain movement patterns or certain strengths or weaknesses, we might see that a knee over time starts putting more pressure on the outside component or the inside component. So oftentimes when people come in and they have some arthritic changes or are having some pain and they're presenting, and by the way they move, it might look like, oh, it looks like they're putting more pressure on the inside portion of their knee. So just like if you sat in a hard chair all day, it's just putting pressure in the same spot over and over and over again, right? So what do? We sit, our butt falls asleep, and we stand up and we move and we get blood flow to the area and things feel better. But what happens if this is the way we know how to move and this is our strategy and we can't get up from that hard chair? And now we're just putting pressure over and over again in the same place. So oftentimes in our rehab process and in exercise processes, and oftentimes it's getting stronger, can help show you a strategy where rather than just putting pressure here, we can put pressure here and we can share the surface a little bit more. So rather than pushing on the same spot over and over again, we can put, half here and half here, and we can move blood flow around and move fluid around so that those tissues can regenerate and we're getting proper blood flow and proper nutrition, and things start to feel better a lot of the time. So I have to say, we've seen a lot of patients that kind of think they're stuck with this pain and stuck with these changes forever, and just manipulating some of these variables and getting them strong in the right place and showing them new strategies for movement have helped to relieve some of that extra pressure and stress that maybe wasn't arthritic changes. Maybe it was just too much pressure in one spot. So again, there are times where this arthritic changes is going to be something that is going to need to be worked around. And there's times when it's not. So if you're having those issues and having those questions, seeing it, talking to your trainer, talking to a physical therapist to see kind of where you are, and having someone who's experienced at evaluating that, understand where you are along that progression and what the right choices for you are going to be, can be a smart thing to do to maximize the capabilities you have. So again, to finish here, I want to talk about strategies. So I've mentioned a few of them, but the big strategies we have, and the one I talk about all the time, is picking a movement menu that is right for you. Okay, so when we talk about exercise, there is a million different ways to do things. We can run, we can ride an elliptical, we can get in the pool, we can ride a bike. And when we talk about overall like cardiovascular health, your heart doesn't really know the difference what you're doing. As long as we're getting a heart rate up and we're getting sweat, it really doesn't matter for our cardiovascular system what we're doing. So finding a exercise platform that is, what I'll say is low risk, high reward, is going to be a good thing for your foundation of exercise. So if we can tolerate impact, that's great, because impact and loading of the joint helps to build up strength. If we've gotten to a point where, like we said, dosage, I used to be able to run 3 times a week without issue, but now if I run 3 times, it's problematic. Well, maybe it's not running. Maybe just as we start getting older and start having some changes, we need to go down to once a week and then supplement twice a week with time in the pool or time on a bike. Maybe we need more variety or variability to our training, so we're not loading the same surfaces over and over again. So a lot of times it's just about having a little bit different strategy rather than maybe just picking one thing and sticking with that. So, and then when we start talking about strength activities, there's a number of ways we can strengthen our legs, strengthening the muscles around the knee, and some of them might not feel good for you. Just based off your anatomy and based off the way things have progressed, some movements might not feel great. We were talking earlier about how sometimes squatting and just the first little bit of squatting can be painful, but squatting deeper ends up actually feeling good. So there's a number of different strategies we can use, whether it's using hand support so we can sit back a little bit further and keep our knee from bending as much, where we can still work that pattern and work those muscles without creating as much tension across the knee. Maybe it's using certain machines that are a little bit less stressful on us so we can still get that same load across the knee. So what I talk about in a rehab process is we usually take somebody and we say, all right, we're going to start with a very small movement menu, and then we're going to increase that menu as we see that those number of things are working. And as sometimes we get pain to go down, maybe inflammation decreases, our menu ends up opening up. So it's something that early on in the process, we want to limit the number of variables so that if something is painful, we know what is maybe causing, or maybe what is not the best choice for you. And then we can start, as things feel better and things get stronger and things get more stable, we start adding pieces onto that menu. So this menu is a little too big for my liking on here. There's too many choices. So I like starting with a smaller thing and then slowly building that out a little bit. The next thing is, like I talked about earlier, we're not cars. Our body adapts to stress. Okay, so the most important equation that we can understand is that stress plus rest equals growth. Okay, so our body is going to adapt to things to stress we put on it as long as we give it time to rest. So the coffee cups on here are a useful analogy, because what I think about is any stress we put on our body, whether it be impact on our knees, whether it be stress on our back, whether it be miles walking, miles running, time on a bike. Think about that all as coffee going into a cup. Okay, if I have this smaller cup here, you can see how I can't fit as much water into that, so I can't handle as much stress. So maybe this cup is you for the first months of your training. We need to have a smaller dosage for you because you're not going to be able to fit enough coffee in the cup. But as we know, our body adapts and gets stronger based off of stress. So after that first month of training, all of a sudden our cup grew to this medium size. And now guess what? We can handle more stress and more load on us. And then maybe again, after another 2 to 3 months, we get this, large grande cup here, and we can fit plenty of coffee in this cup, and we can handle things that, everything that life has to throw at us, and we can handle more exercise. So like I said, the poisons in the dose and the dosage is going to change based off how your body grows and adapts. So this is really the importance of having a plan to what you're doing and having a general progression to how we're doing things, rather than going out blindly and just, trying to work as hard and work through the pain. The third thing is activity modification. So like I said before with the menu, there may come a point in time in our trajectory, there might just be things you notify with yourself. Oh, anytime I run, it just is a problem for me. I've tried different strategies. I've tried different things. And guess what? I don't really love running anyway. So it might be something where you say, you know what? Let's just throw that out because it doesn't seem to be helpful for you. Now, if it's something you say, I really want to run, it's, my quality of life is so much higher if I can run, it's a really big goal of mine. It's something we say, all right, we need to meet certain prerequisites before we get there. And the work we're gonna have to put in before we do that might need to be pretty high. So we have to choose what is the amount of work we want to put into doing something versus what are the activities that are going to be more conducive for us on the long term. So again, it's identifying what things have, maybe been problematic for you consistently and what things always kind of feel good. And then as our cup gets bigger, we can retest some of those activities that were problematic before. So if you're having issues and we have a big menu that we're using right now, my first recommendation to patients is always shrink that menu down. Let's pick things that we are pretty sure aren't causing issues, and then start adding back some of those some more stressful, maybe things that we're a little more concerned about one at a time, so we can then modulate the dosage and have a better idea of what is causing our issues. So having a plan, removing activity as needed, and then recalibrating things as we go is one of the big points. One of the other strategies I wanted to list is continuous daily movement. Okay, and it doesn't always have to be high impact, but I want you to think about movement as this. So when we take that example of our knee being this fluid-filled cavity, so our knee has something in it, and maybe we've heard this term before, but it's called synovial fluid. So synovial fluid is a mixture of water and protein. So what happens is when we move, our body squishes around that fluid and it pushes it to different parts of the joint. And that's how our joint gets blood flow, and that's how our joint gets nutrition, through movement. It happens actively. So when we're walking, we're squeezing blood flow into the joint, we're squeezing nutrition in the joint, and that's how our body gets hydrated. So the analogy I often use is that movement for our joints is like brushing our teeth. Doing it daily is like our daily hygiene routine. Okay, so a lot of patients, I'll advise them to say, okay, you brush your teeth every morning, you brush your teeth at night, but we're gonna do a 5 to 10 minute movement hygiene routine where we're making sure we're moving through joint ranges of motion that we might not hit all day. So we make sure that we are giving optimal nutrition and optimal hydration to every aspect of that joint. So when we talk about that, we always say motion is lotion. The more I move, the more I push that fluid, the more I get hydration, the more I get nutrition to that joint. I slow down degeneration, and I also give myself more capabilities for movement. So doing that every day, just like you brush your teeth, is going to be go a long way for joint health. And that's not just for knees, that's any joint. So finding a 5 to 10 minute movement routine where we're moving through joint ranges of motion can be really helpful for overall long-term joint health. And oftentimes patients that are complaining of pain in the morning feel a lot better once they start moving around and getting some of that fluid pushing through the joint. So it can be something that can help to start your day off on the right tone and help to decrease pain as we move on through our day, and help to increase activity levels, which can have a compounding effect as we move through our day. The next thing I want to talk about, and I'll address before we get to questions, this is a common thing I hear, is pain versus discomfort. So oftentimes when we're exercising, and especially when they're early in that point, there might be a point where we're feeling discomfort or we're feeling pain. And we think sometimes there's a common misnomer that I need to push through pain, no gain. But oftentimes, if we're really talking about pain, it may not be something that's conducive to push through. So it may be something where, analogy I use is that if we have a scab on our skin, right? If we're creating pain, it might be like picking that scab, which might delay a healing process. So anything that's like sharp pain, hot, fast, stinging, anything that's maybe over a 4 out of 10 on our 0 to 10 pain scale might be something that we'll call a red light. So that's something that we want to stop. We want to say, okay, that's probably something on our menu that shouldn't live here right now. It's something we want to talk to our therapist or our trainer about, that, hey, this is causing me what I think to be pain. It's something that's sharp. It's something that doesn't go away. Oftentimes with our exercise, we're faced with what we call yellow lights, which is some like dull, achy type pain. It's something that comes on slowly. It's something that oftentimes will feel better after a warm-up, or will feel better as our sets progress. And it's something that's usually more in that 2 to 4 out of 10 range in pain. So that's what we would call a yellow light, and it's something that we want to kind of keep an eye on to say, okay, I'm noticing this right now. Let's see if it trends towards a red light. So sometimes as we continue our sets, ooh, this was just dull and achy by my third set, yeah, or by my second mile, ooh, now that's sharp. Okay, so that's a red light that turned, or yellow light that turned into a red light. And a lot of the time, though, we have these yellow lights that as we warm up, and it will turn into a green light, where we'll go less than a 2 out of 10, and things will start feeling better. All right. Those green lights are when we're feeling great, joints moving well, everything feels good that day, or maybe it's just a little bit of more muscular soreness, more general soreness rather than pinpoint. Another way to think about that is, if you're talking about where the pain is, typically yellow lights are more of what we'll call our jazz hands. When someone asks you where the pain is, it's a little more general, okay? Versus our red lights are typically more, it hurts right here. So if it's general, it's usually less concerning. It's usually more typically a yellow light. That's not always the case. We could have, 8 out of 10 general pain that's very clearly a red light. But more often than not, we want to keep a closer eye on that pinpoint pain, because that's more often than not a red light. Okay, and those light systems can help us make better decisions on that day as to far as when should I proceed, when should I stop, or maybe when should I modify my dosage for that day to keep an eye on to see what's happening. The other piece of this is oftentimes we might not get this pain feedback right away. We might get this feedback 10 minutes after we're done, 24 hours after we're done. So what I'll advise people to do when they're trying to figure out what is the proper menu for them, or what is the proper dosage of activity, is to keep a journal. Say, okay, today I walked 2 miles. During it was a 2 out of 10 pain. 2 hours later, it was a 3 out of 10. 24 hours later, it was a 6 out of 10. Okay, red light, even though we didn't feel it then, that wasn't red light activity, because 24 hours later, it looks like that created us red light symptoms. So we want to talk to somebody and modify that as we go on. So that's an optimal way to collect data to make the best decisions for you. All right, I know we got questions, so I want to open up the forum, and anybody has questions for me, and I'll take this off screen share so I can see your beautiful faces.
Anthony, this is Pamela. I don't know if you can hear me. I've gone to my cell phone.
I can't. Yes, I can. Yes, I can, Pamela. Yes, I can hear you.
Good. So you were talking about, you were talking about knee pain and the intensity of it. And I get knee pain now when I'm resting. And it also depends, and you talked about how our knees, how our legs are all moving in unison or not unison. So is that sort of a red flag? I mean, I don't mind a little bit of discomfort in exercising, particularly when I'm warming up, but this is when I'm not moving that I get the pain. And is there something I can do to kind of help alleviate that or minimize it?
Sure, certainly. So the first thing I recommend for people who are having pain at rest is see if we can find a movement solution throughout the day to help to mitigate that. So if it's something where if I'm sitting for more than a half hour, I start getting this knee pain, the first strategy I would utilize is every 20 minutes, trying to get up and move a little bit, even if it's just getting up and walking for a minute, or even sitting in your chair and doing some leg pumps. Because oftentimes, like we said, that pain can be related to too much pressure in one place. And if I'm stagnant, I'm not shifting the pressure. So it's finding a way to shift a little bit or remove some of those, or try to push some of that fluid around, get some more blood flow to the area. And that would be the first strategy I would utilize. The second thing I would think about is I would start tracking if I'm consistently having pain with rest, a certain time after I did X, 5 hours before, or X 24 hours before. So tracking trends to see if there's anything that seems to be exacerbating and increasing that pain that we did previously, because that can help define what our optimal menu is going to be and how we can help modulate those activities and that dosage to better manage those symptoms before they happen. All right, any other questions?
Hi, this is Catherine. Yeah, I had a question.
Yes.
Yeah, I'm having knee pain sometimes, and one thing that helps is stretching, but I know I'm not doing it as often as I should. But I was just wondering, is it okay to stretch like before one of my vitality classes? Or, sometimes I've heard, well, you should be like more warmed up before you stretch. So stretching before or after, or both a good thing?
Really, it's seeing what works best for you. If it's something where after you stretch, you feel like symptoms go down and your warm-up can be more productive or your workout be more productive, then go ahead and do that. There's a lot of advice out there, but the biggest thing I always say is treat yourself like your own research experiment and see what works best for you. So if stretching does seem to mitigate symptoms, certainly hit some of those positions that seem to help you before, and maybe you hit them again after your warm-up and see how much that helps you. So, like I said, a lot of times with the stretching and the movement, it's just pushing that fluid into the joint and moving blood flow to where we're creating a little more space and we're getting a little more warmth in the joint where things can move and feel a little bit better.
Yeah, the other thing is, I know I shouldn't, but I'm still working full time and I sit at my computer all day long, and I usually sit cross-legged because I'm really short, and so chairs and everything just don't fit me right. So it's much more comfortable for me to sit cross-legged. And so I know I need to move. I mean, even if I was just sitting with my feet on the floor, I know I should move more. So I was thinking of maybe doing one of those apps for movement or something, you can get on your phone that remind you to move every, 20 minutes? I'm not sure if I can take a reminder 3 times an hour, but is that what you suggest, 20 minutes?
I don't think it needs to be necessarily every 20 minutes. Kind of figure out how long, if you're having symptoms, say I'm having symptoms, if I sit for an hour, then maybe I try to do it every 45 minutes, try to stay ahead of that. So finding kind of works best for you. I think the more often, the better, but you also have to find something that's realistic for your workflow.
Yeah, I gotcha.
And Catherine, it doesn't even need to be something where you're doing something exorbitant, you're getting up and walking. It can be simple as sitting in your chair and doing some leg extensions. So you're just straightening and bending the knee. That can help to mitigate that in between times. So, maybe get up every hour, but every half hour, you're doing some leg kicks.
I got you. Yeah, and
you have to be now to be a physical therapist. You have to have a PhD.
Can everybody mute if you're not talking, please? I'm hearing some background noise. Yeah, I try to make myself go upstairs to the bathroom every time I go to the bathroom. And for those of us who drink water all the time, right, ladies?
That's better than an alarm on your phone.
Exactly. Okay, thanks. Last thing. Do you I have a Fitbit, but it doesn't alert like some people's do, if you haven't moved 200 steps in the hour or whatever. Would you happen to know an app that's a good thing for reminding you, or that you can, set for this movement kind of thing?
I don't have one off the top of my head.
Okay.
I'm sure there's hundreds of them.
I'm sure there are too. Yeah, I can poke around. That's cool. That's cool. I can poke around. I just thought maybe if you knew one right off the top.
Yeah, I don't. Sorry, I don't have one off the top of my head. I have a lot of patients that will just set reminders on their phone and let that buzz them. But I'm sure there's an app that's probably better than having to manually set that. So I'll have to look into that.
Okay. Yeah, I'll poke around too. Okay. Thank you.
Absolutely. Good. Other questions, thoughts, or just things you picked up today that you found helpful?
Well, I can keep talking, but I don't want to hog things.
Sure. I mean, if no one has anything, sure.
I appreciate what you said about, sort of like the knees between, obviously between the hip and the ankle, but those movements impact the knee too.
Mm-hmm.
And I don't know if I'm imagining this or what, but during some of our exercises we do in Vitality, and I get them mixed up, so I forget what it is. We do like a lunge, and then sometimes we do sideways lunge, but I feel like anything that's not where my knee is what I call tracking forward, that it kind of, the pressure from one side to the other kind of bothers me and I need to adjust. So, I mean, do you think more stretching might help that, or thoughts on that sort of tracking thing?
The first thing I would look at is I would bring that up with the coach or trainer you're working with and say, hey, this is bothering me, because oftentimes there's some simple technique fixes or simple modifications for the exercise that can help to take some of the excessive stress away, or help to do it where it just feels better. So that's the first thing I do, rather than kind of throwing out the movement, is trying to find a fix or a just different technical way of doing it that can help to preserve the movement while decreasing symptoms or taking away symptoms. If that doesn't help and you can't find a solution, ask your coach or trainer for an alternative that's working similar muscle groups and working similar patterns that might not be loading and stressing the knee in the same way.
Okay, thanks. Yeah, the coaches like Matt's class and all, I mean, they're great about showing us variation, so that helps a lot. And then
absolutely. And what that'll do is you'll start noticing that, okay, this lateral squat done this way probably is not going to belong on my menu for whatever reason. So you erase it from the menu and you replace it with the alternative they gave you. It's not something, that, okay, every time we do this, I can replace with this instead. Or, you'll learn the technique better. So okay, I can do this now. And if I just do it this way and focus on sitting my hips back or keeping weight through my heel or not letting my knee poke out, it might feel better for me and I might be able to do it.
Okay, gotcha. Thanks.
Absolutely.
If no one else has questions, I actually have a couple that have been sent in by email ahead of time. So the first one is, if I get pain, what is the best thing I can do to relieve it in the short term? Like a bout of acute knee pain.
Sure. So the first thing I would try to do, and again, it's hard to answer this question without specifics, but if there are, I would first look to yourself and look to your history and ask yourself, is there anything that I've done in the past that seems to be helpful? Because oftentimes these patterns will reproduce themselves. So the first question I ask a patient, I try to make my job easy on myself when someone comes with pain, to say, what have you done in the past that's helped? And it might be, oh, ice feels good, or oh, when I elevate my foot, or I wear my compression sleeve, that helps. So I think the first thing that I think about is trying to find a movement solution. So if it's something where we can find just some general, knee bending, knee straightening, non-painful exercise, even if it's getting on a bike and cycling, oftentimes just getting more, like I said, getting more fluid in the joint, getting more blood flow to the area, getting things moving can help be a nice symptom reliever for you. So finding a gentle form of movement that is not problematic and trying to run through, 15 to 30 repetitions of that, depending what it is, and see if things start trending better. Okay. Other things that can help in the acute term for a lot of people, and again, this isn't for everybody, but compression sleeves can be helpful to manage symptoms in the short term. They're not a long-term solution, but they can certainly help to create some compression and some pressure that might feel better for somebody. If you're finding any signs of swelling, elevating the leg and using compression, and oftentimes people use like compression stockings or compression socks that can help move fluid if movement's too painful to do that for them. And again, that's if there's any swelling. So I think the biggest things are movement solutions to help move, to help open up motion, to help desensitize some of the area, and then utilizing elevation and compression if there's any, and movement if there's any sort of swelling.
Excellent. That's awesome. Definitely not a one-size-fits-all approach to it.
Certainly.
All right. And then the second question that was sent in, I know you touched on already, but I'll let you go over it just one more time, is what if I don't feel pain while I'm exercising, but I feel that afterwards. And I know you talked about turning that into a red light exercise.
Mm-hmm. Yeah, absolutely. So that can be tricky. And the biggest thing I recommend doing is creating a journal of activity and how it relates to pain within that time frame, because sometimes it's hard to understand what variable is affecting the issue. And if we track it over a couple days, a couple weeks, we might have an idea. It's like, oh shoot, every time I did those, did those squats, did those step ups at the gym, 24 hours later, it seemed to be bothersome for me. So once we start tracking those trends, we can have better data on ourselves and start picking out what our optimal menu is going to be, and we can communicate better with our coaches. Because say you go and do a workout and you do 10 different activities, and you start having pain 24 hours later. It's like throwing a bunch of ingredients in a soup all at one time. You take a taste, it tastes terrible. You don't know which one it was. If we add them one at a time and we track over time what seems to be causing issue, then we'll know a little bit better what are the proper things for our menu. And then again, just because we say, oh, this squat was problematic or this was a problem, it doesn't mean the exercise in and of itself was an issue. The first thing, like I said, you want to address is the technique, and then you want to address the dosage, because maybe the dosage was too high. So there's a number of different variables that we can manipulate to help understand ourselves a little bit better and help us understand how we're responding to these different stimulus we're putting on our body.
Okay.
Fantastic. Does anyone else have any questions, comments, concerns they wanted to address?
Excellent. Well, I just want to say, guys, thank you for your time and attention. Thank you for your questions. The biggest piece of advice I could give you is, like Matt said, it's not one size fits all. There's a lot of reasons for knee issues. I think a lot of times we put ourselves into buckets. So stay optimistic and find a strategy that works best for you, and treat yourself like your own specific N=1 science experiment, and find a menu, find a strategy, find a dosage that works well, and then start progressing things slowly with the plan, because we can get a lot further than we think. I see it every day in our clinic of people reaching places they didn't think they can go just from having a calculated plan. So believe in yourselves, keep working hard, and just work smart.
Okay.
Anthony, where's your clinic located, may I ask?
Bethesda.
Okay.
And if any of our clients did have any rehab needs for any, acute or chronic issues, what would be the best place for them to find out more information about Rehab to Perform?
Sure. You can go to rehab2perform.com, or you can feel free to directly email me any questions at driannaro@rehab2perform.com.
Is that Italian?
Yes, it is.
I love your last name.
Awesome.
Iannaro. Is that?
Good pronunciation. We very much Americanized it.
Thank you so much. This was really helpful.
Absolutely, guys. This is really enjoyable for me.
Grazie.
Yeah.
Yes.
Yeah.
Thank you so much.
Thank you, Matt.
Anthony Iannaro, everybody.
Yay.
Thank you.
Hey, Susan.
Thank you.
Aw, look at the doggy.
All right. Have a great rest of your afternoon, everybody.
You too.
And
Thank
one
you.
more time, thank you.
Thank you.
Thank
Thanks,
you.
guys.
Bye. Have a good one.
Take care.